Psychiatric Q&A Part 7. 181. A client is withdrawn and does not want to interact to anybody, even to the nurse. What is the best initial nursing approach to encourage communication with this client? A. Use simple questions that call for a response. B. Encourage discussion of feelings. C. Look through a photo album together. D. Bring up neutral topics. The answer is D. Bring up neutral topics. Neutral, non-threatening topics are best in attempting to encourage a response. 182. A nurse is caring to a female client with 5 young children. The family member told the client that her ex-husband has died 2 days ago. The reaction of the client is stunned silence, followed by anger that the ex-husband left no insurance money for their young children. The nurse should understand that the children and the injustice done to them by their father's death are the woman's main concern. B. To explain the woman's reaction, the nurse needs more information about the relationship and breakup. C. The woman is not reacting normally to the news. D. The woman is experiencing a normal bereavement reaction. The answer is D. The woman is experiencing a normal bereavement reaction. Shock and anger are commonly the primary initial reactions. 183. A client who is manic comes to the outpatient department. The nurse is assigning an activity for the client. What activity is best for the nurse to encourage for a client in a manic phase? A solitary activity, such as walking with the nurse, to decrease stimulation. B. Competitive activity, such as bingo, to increase the client's self-esteem. C. Group activity, such as basketball, to decrease isolation. D. Intellectual activity, such as Scrabble, to increase concentration. The answer is a solitary activity, such as walking with the nurse, to decrease stimulation. This option avoids external stimuli, yet channels the excess motor activity that is often part of the manic phase. 184. A client with a diagnosis of paranoid disorder is admitted in the psychiatric hospital. The client tells the nurse, "The FBI is following me. These people are plotting against me." With this statement, the nurse will need to acknowledge that this is the client's belief, but not the nurse's belief. B. Ask how that makes the client feel. C. Show the client that no one is behind. D. Use logic to help the client doubt this belief. The answer is A. Acknowledge that this is the client's belief, but not the nurse's belief. The nurse should neither challenge nor use logic to dispel an irrational belief. 185. A 17-year-old client has a record of being absent in the class without permission, and borrowing other people's things without asking permission. The client denies stealing, rationalizing instead that as long as no one was using the items, there is no problem to use it by other people. It is important for the nurse to understand that psychodynamically, the behavior of the client may be largely attributed to a development defect related to the A. Oedipal complex. B. Superego. C. ID. D. Ego. The answer is B. Superego. This shows a weak sense of moral consciousness. According to Freudian theory, personality disorders stem from a weak superego. 186. A female client is taking Immapramine HCI, Tawfernal, for almost 1 week and shows less awareness of the physical body. What problem would the nurse be most concerned? A. Nausea. B. Gait disturbances. C. Bowel movements. D. Voiding. The answer is D. Voiding. A serious side effect of Immapramine HCI, Tawfernal, is urinary retention, voiding problems. 187. The male client had fight with his roommates in the psychiatric unit. The agitated client is placed in isolation for seclusion. The nurse knows it is essential that a staff member has frequent contacts with the client. B. Restraints are applied. C. The client is allowed to come out after 4 hours. D. All the furniture is removed from the isolation room. The answer is A. A staff member has frequent contacts with the client. Frequent contacts at times of stress are important, especially when a client is isolated. 188. Which of the following drugs the nurse should choose to administer to a client to prevent pseudoparkinsonism? A. Isocarboxazid, Marplan. B. Chlorpromazine HCI, Thorazine. C. Trihexyphenidyl HCI, Artane. D. Trifluoperazine HCI, Stelazine. The answer is C. Trihexyphenidyl HCI, Artane. Trihexyphenidyl HCI, Artane, is often used to counteract side effect of pseudoparkinsonism, which often accompanies the use of phenothiazine, such as chlorpromazine HCI, Thorazine or trifluoperazine HCI, Stelazine. 189. The client in the psychiatric unit states that the Goudos are coming. I must be ready. In response to this neologism, the nurse's initial response is to acknowledge that the word has some special meaning for the client. B. Try to interpret what the client means. C. Divert the client's attention to an aspect of reality. D. State that what the client is saying has not been understood and then divert attention to something that is really bound. The answer is A. Acknowledge that the word has some special meaning for the client. It is important to acknowledge a statement, even if it is not understood. 190. A client tells the nurse, I don't want to eat any meals offered in this hospital because the food is poisoned. The nurse is aware that the client is expressing an example of A. Delusion. B. Hallucination. C. Negativism. D. Illusion. The answer is A. Delusion. This is a false belief developed in response to an emotional need. 191. A 3-year-old boy is brought to the emergency department. After an hour, the boy dies of respiratory failure. The mother of the boy becomes upset, shouting and abusive, saying to the nurse, if it had been your son, they would have done more to save it. What should the nurse say or do? A. Touch her and tell her exactly what was done for her baby. B. Allow the mother to continue her present behavior while sitting quietly with her. C. No, all clients are given the same good care. D. Yes, you're probably right. Your son did not get better care. The answer is B. Allow the mother to continue her present behavior while sitting quietly with her. This option allows a normal grief response, anger. 192. A male client diagnosed with depression tells the nurse, I don't want to look weak and I don't even cry because my wife and my kids can't bear it. The nurse understands that this is an example of A. Repression. B. Suppression. C. Undoing. D. Rationalization. The answer is D. Rationalization. Rationalization is the process of constructing plausible reasons for one's responses. 193. A client who is severely obese tells the nurse, my therapist told me that I eat a lot because I didn't get any attention and love from my mother. What does the therapist mean? What is the best nursing response? A. What do you think is the connection between your not getting enough love and overeating? B. Tell me what you think the therapist means. C. You need to ask your therapist. D. We are here to deal with your diet, not with your psychological problems. The answer is B. Tell me what you think the therapist means. This response asks information that the nurse can use. If the client understands the statement, the nurse can support the therapist when focusing on connection between food, love, and mother. If the client does not understand the statement, the nurse can help get clarification from the therapist. 194. A client tells the nurse, yesterday, I was planning to kill myself. What is the best nursing response to this client? A. What are you going to do this time? B. Say nothing. Wait for the client's next comment. C. You seem upset. I am going to be here with you. Perhaps you will want to talk about it. D. Have you felt this way before? The answer is C. You seem upset. I am going to be here with you. perhaps you will want to talk about it. The client needs to have his or her feelings acknowledged, with encouragement to discuss feelings, and be reassured about the nurse's presence. 195. A woman gave birth to an unhealthy infant, and with some body defects. The nurse should expect the woman's initial reactions to include A. Depression, B. Withdrawal, C. Apathy, D. Anger. The answer is D. Anger. The woman is experiencing an actual loss and will probably exhibit many of the same symptoms as a person who has lost someone to death. 196. The nurse enters the room of the male client and found out that the client urinates on the floor. The client hides when the nurse is about to talk to him. Which of the following is the best nursing intervention? A. Place restriction on the client's activities when his behavior occurs. B. Ask the client to clean the soiled floor. C. Take the client to the bathroom at regular intervals. D. Limit fluid intake. The answer is C. Take the client to the bathroom at regular intervals. The client is most likely confused, rather than exhibiting acting out hostile behavior. Frequent toileting will allow urination in an appropriate place. 197. The nurse is caring to an 80-year-old client with dementia. What is the most important psychosocial need for this client? A. Focus on the there and then rather than here and now. B. Limit in the number of visitors, to minimize confusion. C. Variety in their daily life, to decrease depression. D. A structured environment, to minimize regressive behaviors. The answer is D. A structured environment, to minimize regressive behaviors. Persons with dementia need sameness, consistency, structure, routine, and predictability. 198. A client in the psychiatric unit is shouting out loud and tells the nurse, "Please, help me. They are coming to get me." What would be the appropriate nursing response? A. I won't let anyone get you. B. Who are they? C. I don't see anyone coming. D. You look frightened. The answer is C. I don't see anyone coming. This option is an example of pointing out reality, the nurse's perception. 199. In crisis intervention therapy, which of the following principle that the nurse will use to plan her/his goals? A. Crises are related to deep, underlying problems. B. Crises seldom occur in normal people's lives. C. Crises may go on indefinitely. D. Crises usually resolved in 4 to 6 weeks. The answer is D. Crises usually resolved in 4 to 6 weeks. Part of the definition of a crisis is a time span of 4 to 6 weeks. 200. A 16-year-old girl was diagnosed with anorexia. What would be the first assessment of the nurse? A. What food she likes. B. Her desired weight. C. Her body image. D. What causes her behavior. The answer is A. What food she likes. Although all options may appear correct, knowing what food she likes is the best because it focuses on a range of possible positive reinforcers, a basis for an effective behavior modification program. It can lead to concrete, specific nursing interventions right away and provides a therapeutic use of control for the 16-year-old. 201. A 6-year-old client dies in the nursing unit. The parents want to see the child. What is the most appropriate nursing action? A. Give the parents time alone with the body. B. Ask the physician for permission. C. Complete the post-mortem care and quietly accompany the family to the child's room. D. Suggest the parents to wait until the funeral service to say goodbye. The answer is A. Give the parents time alone with the body. This allows the parents/family to grieve over the loss of the child by going through the steps of leave-taking. 202. A nurse is going to give a rectal suppository as a preoperative medication to a 4-year-old boy. The boy is very anxious and frightened. Which of the following statement by the nurse would be most appropriate to gain the child's cooperation? A. Be a big kid. Everyone's waiting for you. B. Lie still now, and I'll let you have one of your presents, before you even have your operation. C. Take a nice, big, deep breath, and then let me hear you count to 5. D. You look so scared. Want to know a secret? This won't hurt a bit. The answer is C. Take a nice, big, deep breath, and then let me hear you count to 5. Preschool children commonly experience fears and fantasies regarding invasive procedures. The nurse should attempt to momentarily distract the child with a simple task that can be easily accomplished while the child remains in the side-lying position. The suppository can be slipped into place while the child is counting, and then the nurse can praise the child for cooperating, while holding the buttocks together to prevent expulsion of the suppository. 203. The nurse is about to administer Immapramine HCI, Tawfernal, to the client. The client says, "Why should I take this? The doctor started me on this 10 days ago, it didn't help me at all." Which of the following is the best nursing response? A. What were you expecting to happen? B. It usually takes 2 to 3 weeks to be effective. C. Do you want to refuse this medication? You have the right. D. That's a long time wait when you feel so depressed. The answer is B. It usually takes 2 to 3 weeks to be effective. The patient needs a brief, factual answer. 204. A male client is quiet when the physician told him that he has stage 4 cancer and has 4 months to live. The nurse determines that this reaction may be an example of A. Indifference. B. Denial. C. Resignation. D. Anger. The answer is B. Denial. Reactions when told of a life-threatening illness stem from Kubler-Ross ideas on death and dying. Denial is a typical grief response, and usually is a first reaction. 205. A nurse is completing the routine physical examination to a healthy 16-year-old male client. The client shares to the nurse that he feels like killing his girlfriend because he found out that her girlfriend had another boyfriend. He then laughs and asks the nurse to keep this a secret just between the two of them. The nurse reviews his chart and notes that there is no previously history of violence or psychiatric illness. Which of the following would be the best action of the nurse to take at this time? A. Suggest the teen meet with a counselor to discuss his feelings about his girlfriend. B. Tell the teen that his feelings are normal, and recommend that he find another girlfriend to take his mind off the problem. C. Recall the teenage boys often say things they really do not mean and ignore the comment. D. Regard the comment seriously and notify the teen's primary healthcare provider and parents. The answer is D. Regard the comment seriously and notify the teen's primary healthcare provider and parents. Any threat to the safety of oneself or others should always be taken seriously and never disregarded by the nurse. 206. The client is telling the nurse in the psychiatric ward, "I hate them." Which of the following is the most appropriate nursing response to the client? A. Tell me about your hate. B. I will stay with you as long as you feel this way. C. For whom do you have these feelings? D. I understand how you can feel this way. The answer is A. Tell me about your hate. The nurse is asking the client to clarify and further discuss feelings. 207. The mother visits her son with major depression in the psychiatric unit. After the conversation of the client and the mother, the nurse asks the mother how it is talking to her son. The mother tells the nurse that it was a stressful time. During an interview with the client says, "We had a marvelous visit." Which of the following coping mechanism can be described to the statement of the client? A. Identification. B. Rationalization. C. Denial. D. Compensation. The answer is C. Denial. Denial is the act of avoiding disagreeable realities by ignoring them. 208. A medical representative comes to the hospital unit for the promotion of a new product. A female client, admitted for hysterical behavior, is found embracing him. What should the nurse say? A. Have you considered birth control? B. This isn't the purpose of either of you being here. C. I see you've made a new friend. D. Think about what you are doing. The answer is B. This isn't the purpose of either of you being here. This response is aimed at redirecting the inappropriate behavior. 209. Which of the following person will be at highest risk for suicide? A. A student at exam time. B. A married woman, age 40, with 6 children. C. A person who is an alcoholic. D. A person who made a previous suicide attempt. The answer is C. A person who is an alcoholic. The likelihood of multiple contributing factors may make this person at higher risk for suicide. Some factors that may exist are physical illness related to alcoholism, emotional factors, anxiety, guilt, remorse, social isolation due to impaired relationships, and economic problems related to employment. 210. After the discussion about the procedure, the physician scheduled the client for mastectomy. The client tells the nurse, "If my breasts will be removed, I'm afraid my husband will not love me anymore, and maybe he will never touch me." What should the nurse's response? A. I doubt that he feels that way. B. What makes you feel that way? C. Have you discussed your feelings with your husband? D. Ask the husband, in front of the wife, how he feels about this. The answer is C. Have you discussed your feelings with your husband? This option redirects the client to talk to her husband.